first deadly case of Powassan virus in Maine this year is raising concerns among medical experts. Back in June, the Maine CDC reported that an 81-year-old Sanford man died from the virus. There have been 2 other cases in Kennebec and Lincoln counties. That's this year alone, but both people have recovered. Last year, there were 7, and one of the cases resulted in the death of a Topsham man. The alarming trend could continue as tick exposure becomes more of a year-round problem. News Center Maine's Vivian Lee has the latest on tonight's Tick Talk.
Anne-Marie Weymouth hasn't stopped speaking out.
I tell them my story, and so that they know that there's not just Lyme disease out there.
Since her beloved husband of 23 years, Bobby Weymouth, died just days shy of his 59th birthday in May of last year after exposure to the Powassan virus.
He had the rheumatoid arthritis, so he was on medicine that, didn't probably give him a fighting chance against that tick.
Bobby's symptoms started with knee problems and swelling. Those symptoms got worse, including paralysis, neurological issues, and brain swelling. And by the time a spinal tap tested positive for Powassan, it was too late. There is no medication to treat the virus. Experts say everyone is at risk, especially those who are immunocompromised. 1 in every 10 cases are fatal, and half of the survivors experience permanent brain damage. And while scarce, infections are on the rise.
We've been seeing 1 or 2 cases per year in Maine. Actually, last year, though, as in Massachusetts, as in some other states, there was a bump in the number of cases reported.
Dr. Rob Smith is an infectious disease specialist in the Maine Health Institute of Research Vector-Borne Disease Lab director. He says Powassan is challenging to diagnose and must be confirmed with testing that is not widely available. Some patients don't develop symptoms at all, while others can have flu-like issues similar to Lyme disease and other tick-borne infections. But he says doctors are working to identify symptoms of Powassan earlier to catch it before it becomes more serious.
It's on the radar for many more medical centers. When they see somebody with severe neurologic disease, they're more likely to send these tests off.
Experts believe the virus is spread by deer ticks and, in sporadic cases, the woodchuck tick, which has been found in Maine. Chuck Lubelchek, a vector ecologist at the Institute, leads a team of researchers tracking ticks throughout Maine. He says more ticks migrating north and west due to climate change are putting more people at risk for rare tick-borne diseases. MHIR is conducting a study on Isla Ho to see if treating deer and mice with an antiparasitic medication will help drop tick numbers.
So you could look at an alternative to treating your deer and mice in an area instead of spraying synthetic pesticides.
Bobby was a race car enthusiast who raced throughout New England with a display tied to Powassan virus awareness. His former race car has been seen by thousands of people at the New England Racing Museum of Racing in Loudon, New Hampshire. He was also recently honored at the Wiscasset Speedway, where he mentored young drivers. Anne-Marie never misses a chance to celebrate his life, but she also wants to warn others.
Not just Powassan, but all the other tick-borne illnesses. People are out there suffering. They're suffering for treatment. They're suffering for understanding. There's just tick-borne illnesses are exploding.
And to learn about the signs and symptoms to stay safe. In Brunswick, Vivian Lee, News Center, Maine.
Tick samples that are sent into the University of Maine Tick Lab are also tested for Powassan and other tick-borne diseases. We'll have much more on this story on our website and our app.